because if this is the sperm, it sends only its genome. The rest of the DNA and the thing lies outside. Person has severe chest pain and long-standing acid reflux. This is metaplasia. Barrett esophagus is the right answer. Fibrin stabilized by factor 13. That is called fibrin stabilizing factor. When a person is taking exogenous steroid, it will suppress ACTH. That's why we do not suggest a patient to stop suddenly steroids if he is taking it for a very long time, because in the body ACTH goes down, and if you stop steroids abruptly, it would call a Dissonian crisis. And you have seen a lot of patients that ends in the EO in a severe hypotension, BP of 60/30, and a person is in shock. And when you take history, the person is on steroids for asthma or COPD for 10 to 12 years, and she has not taken the dose for the last 10 days. Earliest sign of Mcqs discussed in the details in my previous videos. So earliest sign is perioral numbness. If that is not, next is tinnitus. That is for both, for all of the local anesthetic, for bupivacaine, for lidocaine, for all of these. Now this is earliest sign. Mid sign, you are having the earliest sign, you are having mid sign, and then you are having late sign. The mid sign, the nervous system, seizures, these are the mid signs. The late signs are the cardiovascular signs. That is the vasovagal syncope. There is bradycardia. So the earliest, mid signs, and the late signs. Focus on this. Or here the C is right option. Halothane increases body temperature by the following organ. It increases the temperature by the skeletal muscle. Increases the temperature by, and they are actually talking about the malignant hyperthermia, in which a patient is having rigidity and increase in temperature, and you give what? Dantrolene. Dantrolene causes the inhibition of release of calcium from the sarcoplasmic reticulum, and that then causes what? The relaxation of the muscle. Halothane causes what? H4H. Hepatitis, it causes fulminant hepatitis. These are the bonus MCQs. Heart rate doubled. So the heart rate 1 second is equal to 0.8. If it is increased, the time will be decreased by half. So 0.8 divided by 2, 0.4. Person inhale fully and exhale normally. Now if you see, this is supposed tidal volume, and above that you are having inspiratory reserve volume. So what happens? From here a person is inspire, so, and below tidal volume you are having expirate. This is suppose expiratory reserve volume, and you are having, this is residual volume. So from here a person does what? He inspires fully, so he goes fully. So if a person inspires fully, what is this called? This is called what? Total lung capacity. If a person inspires fully, this is total lung capacity. If a person inspires fully and then expires fully, focus on this. Inspires fully, this is total lung capacity, but then expires fully. Now this is the full expiration. Expires fully. This is the vital capacity. Focus on my word. These are the MCQs of the part first. Only inspires fully, the total what is this called? The volume of air in the lung. This is called total lung capacity. Inspires fully and then expires fully, this is vital capacity. It include what? It include expiratory reserve volume, tidal volume, and inspiratory reserve volume. Now coming toward this MCQ, I will shade it with the green. So starting from here, this is tidal volume. A person inspires from here. So a person inspires fully and then he expires normally. So whenever a person expires normally, he comes toward the tidal volume. This is the start of the tidal volume. So what is this thing called? This is called inspiratory capacity. This is called inspiratory capacity. Inspiratory capacity mean the upper two. Expiratory capacity mean the lower two. Or this is also called the functional residual capacity, the lower two. So this is actually what? Inspiratory capacity. This is what? Inspiratory capacity. The volume which remains left after forced expiration. Now the same thing, you are having a residual, expiratory reserve volume, tidal volume, inspiratory reserve volume. So if you expire fully, you cannot expire the residual volume. The volume of lung, this thing, remain in the lung is called residual volume. Which volume cannot be measured with spirometry? This thing, because you cannot exhale it. During decreased height of action potential, now let's suppose this is the action potential, the upstroke, and this is then the downstroke. Let's suppose this is upstroke, then this is downstroke. So the upstroke, this is caused by the influx of sodium. We are talking about the myocardium, not the SA or the AV node. So decrease of height of action potential in myocardium is due to hyponatremia. Focus on my words. If there is SA node or AV node, this upstrike is caused by upstroke is caused by the influx of calcium. This is caused by the influx of calcium. So in the SA node or the AV node, if there is decreased height of action potential, the answer is decreased calcium. Decreased calcium. So if there is a word like myocardium, the answer is different. If you are having the SA or the AV node, the action potential is mainly caused by the calcium. That is the calcium influx. So if a person is having hypocalcemia, there will be decreased height. Next, most common cause of mesothelioma is asbestosis. Inferior hypogastric, that is the right answer is 2 to S4. CSF differ from the plasma, that is low pH. If there is not in the answer, then low glucose, not the high glucose. If the question is plasma differ from the CSF, the answer is high pH. If there is not in the answer, then the answer is high glucose. A female has a history of recurrent abortion. It is due to antiphospholipid antibody syndrome. Which of the following microorganism is transmitted by mosquito bite? So you are having malaria, you are having yellow fever, and you are having filariasis. Pituitary crisis is due to decreased surfactant and increased surface tension. Decreased surfactant and increased surface tension, because surfactant decrease surface tension. If you are having no surfactant, then there will be increased surface tension, and increased surface tension causes collapse of the lung. Inferior epigastric artery, the branch of external iliac artery. Undescended testes is at risk of malignancy, but they will confuse you. A patient is having undescended testes. The descendant testes, it is risk of, that is infertility. Infertility. The undescended testes formal is because of at risk of malignancy, and that malignancy is because of high temperature. The descended testes, that is in fact that is at risk of infertility. Next, patient has fourth nerve palsy with the following muscle involved. So SO4 LR6. Lateral rectus by 6 and superior oblique by 4, and all others by 3. So option B. On actions of the extraocular muscles, I have made another video you can watch on my YouTube channel. And ICU spread of infection can be prevented by frequent hand washing, because if you examine one patient and you did not wash your hand and move to another patient, you are spreading this infection to that to that. Damage to the lateral hypothalamus. The lateral hypothalamus actually causing what? The lateral hypothalamus causing increase in hunger if it is stimulated, but if it is damaged, it causes decrease in hunger. It causes decrease in hunger. Rectus sheath form posteriorly between the umbilicus and xiphoid. Now this is very important. Let's suppose this is the lower chest, this is xiphoid process, and this is umbilicus. So in between these two things, the rectus sheath is formed by which things, and below the umbilicus it is formed by which thing? Above the umbilicus, they are actually talking about above the arcuate line. They are actually giving you a clue that we are above the arcuate line. Now above the arcuate line, rectus sheath is formed by what, and below the arcuate line, rectus sheath is formed by what? Coming toward that, rectus sheath is actually a sheath that is formed by aponeurosis of the muscles in the abdomen. So let's suppose we are taking cross section of the abdomen. So you are having the external oblique like this. This is muscle, and it goes straight, and this is the midline. Then you are having internal oblique. This internal oblique splits into two. So you are having external oblique, then you are having internal. This splits into two, and then they join in the middle. This is called linea alba. Similarly, on the other side, you are having external oblique, and then you are having internal oblique, and that is divided into two, anterior portion and posterior, and they join in the middle. This is called linea alba. Then you are having transversus abdominal, it goes posteriorly on the other side as well. So if you focus on this diagram, this is what thing, this portion is actually the rectus sheath on this side, and this is the rectus sheath on the right side. So, and of course it has having muscles and other contents as well. So this is above the umbilicus, this is above the umbilicus, this is between the xiphoid process umbilicus, or you can say above the arcuate line, So it has got the interior portion. This is called interior portion. This is anterior portion. So the anterior portion is formed by external oblique. This is external oblique, and the interior fiber of the internal oblique. This is the interiorly. Posteriorly, it is formed by the posterior fibers of internal oblique. This is the posterior fiber of internal oblique, and this is transversus abdominis. It causes posterior portion of rectus sheath. This is above the arcuate line. Focus on my word. This is above the arcuate line. In the question, they are asking about posteriorly. Rectus sheath is formed posteriorly by the posterior fibers of the internal oblique and the transversus abdominis muscle. These both combine together to form posterior portion of rectus sheath. If they ask about interior, then external oblique and interior fiber of internal oblique. So I think I am clear. In the midline, they form linea alba. Below the arcuate line, what happens? All the three muscles, this goes interiorly: internal oblique, external oblique, and transverse abdominis. Then the posterior surface is formed by fascia transversalis. This is fascia transversalis. This is below the arcuate line, or below the umbilicus. Posteriorly, it is formed by fascia transversalis, and anteriorly by the aponeurosis of all the three muscles: external oblique, internal oblique, and transverse abdominis. Coming next. Patient receive treatment for cancer and develops vomiting, nausea, rectal bleeding. This is actually the radiotherapy causing damage to the mucosa. Next, source of fuel and long-term fasting, that is alanine plus glutamine, not glutamate, glutamine. So the answer over here is alanine. That is the right answer. What is the function of cortisol? That is increase in gluconeogenesis to release glucose. Next, endocardiolipin mitochondrial membrane is the right. Most common benign tumor of salivary gland, that is called pleomorphic adenoma. Ectopic thyroid produced by squamous cell carcinoma of the larynx. The small cell carcinoma, it produces mainly ACTH, ectopic ACTH, and this can cause Cushing syndrome. That is actually another thing. That is another thing. Next, stone needle percussion and pleural effusion. Next, person has been working in a nuclear energy formation company. He recently diagnosed with cancer. Ionizing radiation causes cancer. Why? Free radicals. Right answer. During isoflurane anesthesia induction, hypotension is developed due to decreased vessel tone. That is the right answer. Now, in the epidural anesthesia, what is the most common complication? Urinary retention. And in the spinal anesthesia, most common is hypotension. If that is not in the answer, then headache. Next, recurrent laryngeal nerve damage leads to hoarseness. That is hoarseness, 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 and phone. Phone is from cerebellum. There is a problem in the coordination of the muscle that was supposed to be contract in a specific sequence. I am saying we are doing MCQ. For this sentence, there is a specific sequence of muscle contraction in mouth, in the tongue, in the throat, in the larynx. But if I am saying pick the book, now for this sentence there is another set of muscles that are activated. So you are having problem with the cerebellum. Coordination is lost. If coordination is lost, so that specific sequence of contracting the muscle is lost. This is phone. Dysphonia mean that aphonia mean you are having nothing coming out. You are having nothing coming out from the mouth. Dysphonia mean you are having coming out from the mouth, but that is having different meaning. Hoarseness mean the voice is hoarse, like whispering. This is hoarseness. And dysarthria is also coming from the cerebellum. But aphasia, dysphasia, this come from the cortex. Or here B is right answer. A female is giving birth in operation theater. She is not responding to oxytocin. So for me there is decrease in the receptors. What affects the positive reductive? Whether there is prevalence is the right answer. The patient is on dialysis having oral ulcer. The deficiency, this is vitamin B6, oral ulcer. But if says angular cheilitis, B1. Rotation of head to the opposite side by sternocleidomastoid, C is the right answer. Rectus sheath form interiorly above the arcuate line. We discussed right now. External and internal oblique. Posteriorly above the arcuate line. This is formed by internal oblique and transverse abdominis. So over here the C option is right. So the rectus sheath form interiorly above arcuate line. So we are having external and internal oblique, and posteriorly it is formed by the internal and transverse abdominis. But below the arcuate line, anteriorly it is formed by all the three muscles: external oblique, internal oblique, and transverse abdominis. Posteriorly formed by fascia transversalis. Aldosterone act on which of the following organelle nucleus? Most important factor in the second stage of labor: abdominal muscle contraction. But if the question says the second stage of labor is augmented by, then this is augmented by oxytocin mainly. Most important enzyme for protein digestion present in pancreas is trypsin. Female has been suffering from night sweat, weight loss, and cough. Definitive diagnosis of TB is culture. If that is not in the option, then gene expert. By gene expert, I mean PCR. So over here PCR. CT scan is not the right option. Child came to the pediatrician with proteinuria of 6 gram. What is the following defect? Minimal change disease, basement membrane proteinuria. Which of the following is related with rigor mortis? That is decrease in ATP. Now focus on this. If this is your skeletal muscle, for the contraction of muscle you need calcium. But calcium are stored in the sarcoplasmic reticulum. For the uptake of calcium, you need ATP. If there is no ATP, there is no uptake of calcium, and there is calcium in the muscle. If there is calcium in the muscle, it causes sustained contraction and causes rigor mortis. Next, with the following structure lie interior to sternocleidomastoid muscle, external jugular vein. Indicative of ovulation in female is increased cervical mucus. Mucus is increased. A female got UTI, she has systemic binding, and till she is raised they want to know about the urosepsis. Which true about the familial adenopolyposis, autosomal dominant. Newborn baby with meconium and vagina. Rectovaginal fistula, because meconium is the stool, so the stool comes to the vagina through rectovaginal fistula. Patient has diphtheria, discussed in detail. Toxide causes type 3 hypersensitivity reaction. Hormone release from the following during last trimester, that is placenta. Which of the following addition increase effect of local anesthetic? Because of epinephrine. What it does, it causes vasoconstriction. So if you inject the local anesthetic, usually it is carried by the blood and deactivated. But if you are having vasoconstriction, it cannot be taken from the blood, and there is prolonged action of local anesthetic. What is the intermediate host in which of the following? Man is the intermediate host in which of the following diseases? Hydrated disease. Cyclic MP is seen in the following effect, that is the TSH. Pregnant female came for her follow-up an ultrasound. The following is not increasing in this female. Growth hormone is not increased, and this function is taken by human placental lactogen, causing the growth. Earlier sign of Buffy-Can discussed in detail, ringing in the ears, obstruction of the duct associated with. So if you are having, this is the duct of the gland, it is obstructed, so it activates the apoptosis. A non-diabetic with hypertension presented with hypoglycemia. Now it is actually propranolol. Propranolol, because the beta adrenergic stimulation of the liver, it releases what? Glucose by glycogenolysis and gluconeogenesis. But if the receptors are blocked on the liver by androl or propranolol, then there is no release of glucagon. The other three, they are beta 1 receptor blocker. In the liver you are having beta 2. Only the propranolol blocks the beta 2. These two do not block the beta 2. Coming next, most important enzyme in digestion of protein in pancreas, trypsinogen for pancreas, for protein in the stomach, pepsin. Which the following is deadly virus, that is hepatitis D is for D, E for epidemics. Rectus sheath posteriorly between the umbilicus and xiphoid process is formed by, already discussed in detail, posterior fibers of internal oblique and transverse abdominis muscle, but above the umbilicus. Below the umbilicus, it is the three muscles anteriorly and fascia transversalis posteriorly. Rectus sheath formed anteriorly above arcuate line is by, already discussed, external oblique and anterior fibers of internal oblique. With the following is true about bladder, so it has got both sympathetic and parasympathetic. But if say the pain is lost from the bladder, pain is lost, which fiber are lost? Sympathetic. Pain goes through sympathetic. That is another MCQ. That is another MCQ. Coming next. What is true about segmental bronchiole cuboidal epithelium? Next. Difference between type 1 and type 2 hypersensitivity reaction. That is, you are having 1, 2, 3, 4. The 4 is cell mediated. The other 3 are immune mediated. The other 3 are immune mediated. 1, 2, and 3, these are immune mediated. 4 is cell mediated. These 3 are immediate hypersensitivity reaction. 4 is delayed hypersensitivity reaction. 4 is delayed hypersensitivity reaction. These are caused by immunoglobulins. It is caused by the T cell. It is caused by the T cell. The immunoglobulin in type 1 is IgE. The immunoglobulin in type 2 is IgG and IgM both. The immunoglobulins in type 3 is IgG. And in 4 you are having mainly the cells, T cell, that cause destruction. So between the 1 and 4 are if asked about, between the 2 and 4 are asked about 3 and 4, the answer is the 1, 2, 3 are the immune mediated, 4 is the cell mediated. But we're here, the main difference between the 1 and 2 is complement mediated, because the 1 does not fix the complement, the 2 fix the complement. Straightforward. Patient has fourth nerve palsy, the gaze fixed will be, well, I have made a video on it on my channel, how they work, because if you see that, you cannot forget it, and the CPSP cannot play with your concept then, because it is difficult for me to demonstrate it on this, but that is supromedially. Common cause of fatty liver in our country is malnutrition. If that is not, next is obesity. ECF differ from the intracellular as more sodium concentration in the ECF. If the reverse is intracellular differ from the ECF, then more potassium concentration.